Hi, and welcome back to the Dr. Ramsey Show. Today, there's something special for you and your loved ones if you're interested. We're going to review a non-invasive test that you can do to see if there's anything going on in your body that you don't know about. And with me is Dr. Sadegi from SimonMed to help us understand what this test is useful for and why we might consider doing it. Welcome.
Thank you. Thank you for having me.
It's very nice to have you.
Thank you.
And we love SimonMed. We use SimonMed a lot for our imaging.
Excellent. Thank you.
Yes. And I think you're in charge of this program. Is it the Simon 1 whole body MRI?
Correct. So Simon 1 is under SimonMed. It is our whole body MRI screening to look from the head through the pelvis for disease processes. At Simon 1, we're committed to saving lives by making preventable healthcare accessible.
Yes.
Through Simon 1, we are combining over 20 years of clinical expertise in whole body imaging, cutting-edge artificial intelligence, and the most advanced medical equipment to deliver a powerful exam at previously impossible pricing and speed. You know that approximately 1 in 3 Americans will develop cancer in their lifetime.
1 in 3?
1 in 3 Americans will develop cancer in their lifetime. Detecting cancer and other disease processes early, patients often have better treatment options and higher survival rates. Simon 1 has significantly reduced the scan time and the price point using innovations in artificial intelligence to become the nationwide leader in accessibility, both in terms of cost and footprint.
Right. And I think you're absolutely right about saving lives because these patients didn't even know something was going on before the image.
Exactly.
And then they could treat it before it became untreatable.
Exactly. We have so many examples such as that. So for instance, aneurysms in the brain. We've picked up many brain aneurysms in which they could potentially rupture, resulting in death. And so these patients can be watched over time to ensure that the aneurysm is stable. If it's not stable, they could undergo coiling to prevent future rupture.
Right. Absolutely. And I know for myself, the reason I'm very interested in this is one of my patients went in to do this test herself, and she and her husband both did the test, and she found out that she has an issue in her brain that she didn't know about. It's called low hippocampal mass. It was like 11%, and her husband was like 90%. So we're treating her now. She has no symptoms. She has a very high quality of life that she likes to live, so this shocked her.
Yes.
And she's so grateful she did it because now we're actually treating her.
So in our standard MRI examination, we are offering what's called NeuroQuant. And NeuroQuant measures the 3D volume of all the structures in your brain. And the exam that she had, it showed that one part of the brain was smaller than it should have been. This could potentially be associated with disease processes such as Alzheimer's disease, frontal temporal dementia, dementia with Lewy bodies, temporal lobe epilepsy, or even hippocampal sclerosis. And then your patient will be able to follow the volume of her brain structures over time to see if there has been any change.
Does it surprise you that she doesn't have any symptoms?
No, because it is important to see these early, and patients who do have changes, it doesn't necessarily mean that they definitely have the disease process. What it could mean is that they may be potential to have this in the future.
Correct. Right. And I know that you look at the whole abdomen, and then there's a specific test that adds on deeper looking at the liver.
Exactly.
And I don't remember what that was called.
So what we're looking at, it's called a liver multiscan.
Okay.
And so it is part of our plus examination, and we do advanced liver imaging where we take special images of the liver. Approximately 25% of Americans have non-alcoholic fatty liver disease.
A quarter of us.
A quarter of us do. This is a problem because this can turn into what's called non-alcoholic steatohepatitis, or NASH. NASH can develop into fibrosis and even cirrhosis, and could potentially even require a liver transplantation. So what we do is we're looking at the fat content in the liver, and we give an actual percentage. If it's elevated, that could mean that there is non-alcoholic fatty liver disease. We then look to see if there's any inflammation in the liver. If there's inflammation, that would be considered non-alcoholic steatohepatitis. What's important about this is that patients then can become proactive. They could then change their lifestyle and their diet in order to help decrease the fat in their liver, and then therefore decrease their risk for potentially resulting in fibrosis or cirrhosis.
Right. And I think that's magnificent, especially if people are motivated to take care of themselves.
Yes. This type of inflammation previously was required to find it out. You were previously required to have a biopsy. So this is a new advanced imaging technique that we're offering for the plus in the MRI. MRI
And this
plus.
is so non-invasive, it doesn't even include dye, right?
Exactly. You will not be getting a IV. You will not be getting any intravenous contrast, so there's no risk of allergy. And in addition, there's no radiation with an MRI as opposed to CT.
Yes. And I think she said this test was shorter than she thought it would be, because MRIs in my mind are long tests.
Yes.
This is a 45-minute test?
Yes, so we have our standard MRI whole body Simon 1 examination is 30 minutes, and then the plus, which adds on the liver, and then prostate for a male, and a female comprehensive for the female patients, that exam is 45 minutes long.
I see.
And so it's a little bit longer, but you are correct. MRIs are long exams. However, due to our advanced MRIs, 3T Tesla imaging, we're able to significantly shorter the exam. You are getting, for just the standard exam, you're getting an MRI of your head, an MRI of your neck, a magnetic resonance angiography of your head, a magnetic resonance angiography of your neck. You're also getting an MRI of your chest, abdomen, and pelvis, all within 30 minutes. This examination used to take a significant amount of time, well over an hour, and due to our advanced imaging, we're able to significantly reduce that time.
And is the advanced imaging what you're speaking of, the artificial intelligence? Is that what it is?
Advanced imaging, basically meeting techniques, overall techniques in the way that we are imaging. As technology in MRI has improved, the scan times have significantly decreased. SimonMed and Simon 1 has the most advanced MRI scanners, and so our imaging time is as low as it can be.
Right. And can you explain a little bit about what the artificial intelligence is?
Yes. So, for instance, we use artificial intelligence with the prostatic imaging. When you have an MRI prostate screening examination, or if you, let's say, a patient had an elevated prostatic specific antigen and you wanted to see if there was a prostatic lesion, a standard MRI of the prostate gland is a examination with and without contrast.
Yes.
And so we inject contrast and we look at the enhancement of the prostate gland. Now with the artificial intelligence that we are now using, we're able to no longer require the contrast administration. In addition, we only require 9 minutes of imaging for the entire prostate part of the examination.
9 minutes?
9 minutes. So the patient is in, lays down, 9 minutes later they are finished. And so we have added that examination to the Simon 1 Plus examination. And so the Simon 1 Plus examination uses the prostate. As far as with the artificial intelligence, what it does is it uses an advanced technique called restrictive spectrum imaging, RSI. And so the RSI is an advanced diffusion technique, and it uses the artificial intelligence and fuses the images with, it fuses the restrictive spectrum imaging images with the images of the anatomy. And so you can know exactly where the lesion is in the prostate gland. The reason why this is important is that the radiologists, they go in, they mark exactly where the lesion is in 3D. We provide these images to the urologist, and then the urologist is able to input this into their system when they take the ultrasound guided biopsy. and the biopsy the images that we send them tell them exactly where to take the biopsy, so they're not taking a blind biopsy in the prostate gland.
And is that done at SimonMed, or where is that biopsy done?
The biopsy is done at the urologist's office typically.
Okay. Because there is an imaging center in California in Palm Desert called Desert Medical Imaging, where they do, in the imaging center, a laser ablation of the prostate lesion.
Okay.
An MRI laser ablation. So they go right to it and they treat it.
And that is a very good, that is beneficial for the fact that the MRI, you're getting the images right there.
Yes.
You know exactly where to put.
And you go right
the
there
needle.
without messing the whole prostate up.
Exactly. And what we're doing is similar, because it's not on the MRI. We're taking the MRI images, so providing it to them for their ultrasound guided biopsies.
Right. I understand. Yeah, I understand. And I think this is an amazing tool for patients. Patients can choose to go see you even without my order. Mm-hmm. The basic MRI whole body is $650.
Correct.
And the enhanced, if we want the enhanced imaging of the prostate, it's $1,250, I
Correct.
believe. And that includes the brain, the neck, the chest, the thorax, the breast, everything, all the way down to the pelvis.
Exactly. And so, as you stated, patients can self-referral. This is an examination without radiation, and so the patients can call Simon 1 and order the examinations themselves. After we perform the examination, the part above the neck is read by a neuroradiologist. Mm-hmm. This is a radiologist who subspecializes in neuroimaging. Mm-hmm. From the neck down, it's read by a body imaging radiologist who subspecializes on the chest, abdomen, and pelvis.
I see.
And after the examination is read, we have a consultation with the patient over Zoom. Mm-hmm. During that Zoom consult, the patient will be able to see all of the key images. They will be shown the findings of their examination, and then they will also be it will be discussed with them what the findings of the examination are and any appropriate follow-ups that they would need to have. This is a screening examination, meaning that it's not for a specific reason. It's a screening examination, meaning that we possibly will find something. And so if we find something, we will need additional images in order to find out what it could represent.
Like a breast mass?
Exactly.
Or something like that.
A breast mass may just be a benign breast mass, such as a fibroadenoma, or it could be a cancerous tumor. Mm-hmm. And so if we see a breast mass, we will refer you to mammography and additional imaging.
Mm-hmm. Right. So it is a screening, and then the diagnostic will follow if needed.
Exactly.
Diagnostic imaging.
And that's very important to understand that this is not, if you have back pain, you should get an MRI of the lumbar spine. Mm-hmm. You should not be coming for this exam.
It's not as detailed for that.
Exactly.
Yes.
We do take images of your lumbar spine. We are able to comment on your lumbar spine. However, we cannot provide the level of detail if you got a full MRI of your lumbar spine.
Exactly. And so to close, what are some of the things that patients have done this test for and found conditions that they were able to do something about? Give us some ideas.
So in the neuro part, in the brain, we've seen many small aneurysms in the brain. Mm-hmm, this is very important because aneurysms could potentially rupture. They need to be followed over time. If they're unstable, they may potentially need to be treated with coiling. Mm-hmm. We have found other lesions in the brain, such as arterial venous fistulas. We've also saw small cavernomas in the brain. As far as masses in the brain, we found a 2.5 centimeter pituitary mass in a 27-year-old.
Wow, that's a pretty big
It's
pituitary
a very
tumor.
big tumor, and it actually, I stated that this is a screening exam. We came to find out that the patient actually had headaches, and he had visual disturbances, and the reason for the visual disturbances is that the mass was pushing on his optic chiasm, and so he was having difficulty seeing. Mm-hmm. We also have found thyroid masses, thyroid cancer. We found metastatic disease throughout the vertebral bodies. We found pancreatic masses with metastasis to the liver, adrenal glands, and adrenal glands. We've also found many prostatic nodules that could potentially be cancer. We found many patients with non-alcoholic fatty liver disease, and we found some patients with non-alcoholic steatohepatitis, which hopefully we can encourage them to change their lifestyle and their diet in order to reverse the non-alcoholic steatohepatitis.
Exactly.
We've also found many aortic aneurysms. For example, a 4.8 centimeter thoracic aortic aneurysm we found, and additional aneurysms that we've found as well.
It's because people won't feel a lot of these things that you're saying. You just won't feel it until it's too late.
Exactly. This exam is perfect for patients who want to be proactive in their health, who want to prevent things either through changing their diet, their lifestyle, their exercise. But then again, there are other things that can be done potentially, such as treating an aneurysm.
Yes.
So patients who want to be proactive, this is a very good alternative option for them.
Good. I have two other questions. One, are you able to see the beta amyloid plaque in Alzheimer's patients on this?
No.
Okay, I didn't think so.
Yes. No, we're not.
And personal for me, like I had a hernia because I split it when I was doing a back bend. Would that show the intactness of the sutures, do you know?
Yes. So if the wall is intact, definitely we will be able to see it. We see hernias all the time on this examination.
Okay.
And so if there is a diastasis or a widening, we will definitely be able to see that, measure it, tell you how far apart it is, to be able to tell you if fat is protruding through or if there's a loop of bowel protruding through. So we will be able to.
Or if I can do back bends again.
Exactly. Yes. Yes.
That's how I did it in the first place.
Oh, no.
So I'm a little nervous. If it's intact, I'll do them.
To recur, yes.
Yeah. But thank you. You're a wealth of knowledge. And I think a lot of my patients are going to take advantage of this.
Thank you.
Because it's non-invasive, it's a quick test, and you get a lot of information from it.
You get a lot of information, and it's at a price point right now that it's never been.
Right.
At $650, we're offering this. Nobody's offering it at a price point close to this. And so if you want to be proactive with your health, this is a very good opportunity with the advanced techniques that we have, the speed of the imaging, and the quality of the imaging.
And the review of the image with the radiologist. So would the patient speak to both the neuroquant and then the general radiologist?
Yes. So when we review the images, we review the entire examination. We'll review the MRI of the head and neck. We'll review the neuroquant, obviously the chest, abdomen, and pelvis, the advanced liver imaging, and the advanced prostatic imaging in males and female imaging in females.
Right. Well, thank you so much for coming today and giving us your time.
Thank you, Dr. Ramsey.
You're
Appreciate
welcome.
your time.
And thank you so much for listening. If you're interested in more information, please give us a call or call Simon 1. Thank you. Bye-bye.